So my name is Amy Larman and I am a community midwife. Day to day I may see ladies at the GP surgeries, looking after them during their pregnancy, all the way through until they deliver. If they deliver at home, then we may attend them at home if we are on call. And day to day we might visit ladies at home when they've had their babies. I like the freedom to take charge of my own diary. I like that I get all of my own ladies who I can see multiple times and get to know them and become part of their pregnancy. And I work in a lovely small team, which is really nice. It can be challenging when there is a lot of workload compared to the number of people that we have to do the workload, and that can change depending on the number of babies that are born at any one time. It can be challenging when you're on call and you have to get up in the night and go and see to a lady at a home birth. But there are challenges that mean that we work well together as a team, which is really nice. What I do like about our unit is the way that we work together as a team. I've worked on the labour ward here at Stoke Mandeville, in the birth centre at Stoke Mandeville, and I've also worked at the birth centre in Wickham, which is a completely different type of unit. And now I'm working in the community, so I've got the ability to work in many different areas with a variety of different people, which is really enjoyable. Working in the community where I work at the moment, it's nice because we all have our own ladies, but we work together, and it's good that we can help each other out, especially as I'm quite new to the community. I've felt that everybody's very approachable and I can go to people if I need to get more support. In the unit when I've worked on the labour ward, we all know each other very well, and some people I'm good friends with, but then if we have an emergency situation, we're able to put our different hats on and work together in an emergency, which is really nice and it makes you feel good. I have really enjoyed working here, and at any point where I've considered would it be beneficial for me to move elsewhere, the thing that has actually kept me here is the people that I work with and the friends that I've made here, and that I know that anybody coming in has always been welcomed. We have a great supportive team who helps you when you first move here. No matter how experienced you are, you have supernumerary time and lots of support to get to know the place and the people and how it works. So it would definitely be a good idea to come and work with us.
Hi, so I'm Linda and I'm a midwife working for Buckinghamshire Healthcare Trust, and I predominantly work in the birth centre. Birth centre, we tend to look after low risk women, so that's women that haven't had any complications in their pregnancy and don't require an epidural for pain relief, and so they come to us and we do all the intrapartum care for those. And at the moment we have just started a continuity team, so there's 6 of us in the birth centre working in the continuity team, and we're seeing low risk women from booking right through to delivery. On a day-to-day basis we give intrapartum care to low-risk women, and we have now set up a continuity of care team which is called the Blossom team, and there's 6 of us that work within the continuity team. We see low-risk women from booking up until the delivery, and the idea is then that they have continuity of care with seeing the same midwife throughout their pregnancy. With continuity, research has shown that it is beneficial to women and babies. It gives a higher incidence of a normal delivery rate and a good outcome for the baby, and they believe this is because the woman has faith and trust in her carer because she's known her throughout her pregnancy, and also as a carer you know your women and will recognise earlier if there is any change or any complications. This is a fairly new thing, and we were all a little bit like sceptical at the beginning, thinking how's this going to work, is it going to be beneficial as they say, and we've been running for a few months now, and already we are starting to deliver our ladies, and you just can't explain the feeling that you have when you walk into a room and it's somebody you know, and then that bond and that trust is there straight away. So it's, I think it's beneficial for the women and also for us. We come out from that delivery with a real great sense of achievement. The challenges that I would say we face within the NHS as a whole obviously is being able to give that time that you want to be able to give to all of your women, and as we know, with staff shortages and sickness and things, that can't always happen. and you just want to be able to be your best all the time, and that's probably what's frustrating, that sometimes you have to leave somebody to go and look after somebody else, and you haven't really rounded off that care like you'd like to. I really enjoy working for this trust. I did my training within the trust and have worked here ever since. I cannot see myself going anywhere else to work. I do live locally, so obviously that is a benefit, and the area obviously is a lovely area to live in. But mainly I'd say it's just the friendships we have here. We do have a really lovely group of colleagues, and when we're not going through a pandemic, we have a really good social life. So there's often, probably monthly, something going on somewhere that you want to go to. If it's something you're considering, then absolutely come and have a look round, because like I say, it's a really lovely environment to work in. I love the fact that we do concentrate on safety and care for the women, which is something that I believe is paramount within midwifery and the healthcare service. Yeah, it's just a great place to work. It's a lovely environment, and you should definitely come and have a look and see.
My name is Stacey and I'm a midwife.
Okay.
My role day to day is really varied. Sometimes I can be on labour ward delivering babies, and other days I'll be upstairs on the wards, so the antenatal and postnatal wards. So today I am looking after antenatal women early on in their pregnancies and making sure their babies are okay. And it's really varied every day. We deal with lots of medications, we deal with CTG monitoring and lots of observations as well.
What do you love most about your job?
The thing I love most about my job is the people that I get to see every day. We have such a good range of women here that we look after. All of their families are really nice, and they're also friendly, and it really keeps us going when we're at work. Probably the biggest challenge is staffing. We are sometimes quite short-staffed. Time management as well. Sometimes there just doesn't seem to be enough hours in the day to get everything done. But we work really hard to prioritise, and we all work really hard as a team to help each other out as well. I did my training here at Bucks Trust, and I just really loved the whole environment since I trained here as a student midwife. I found that I made friends really easily here, and I really enjoy the demographic of women that we have as well. The demographic here is really varied, so no 2 days are the same. We'll have many different women and families to look after, and it's never boring. There's never the same patient twice. So every day is really interesting. I think for people considering working at the Trust, I would encourage them to. It's a really friendly team. We're really supportive of everybody. I've made loads of friends here, and it's just a really nice environment to work in.
I'm Emily, and I work mainly in Rothschild ward and delivery suite. So on a day-to-day basis, I can either be working up on the ward, discharging patients, helping with breastfeeding, antenatally, helping with inductions, and then on delivery, obviously delivering, going to theatre. I love about my job the care with the women, whether it's upstairs on the wards or downstairs on the labour ward, being their person. So straight away, in any midwifery job, you have to build a rapport with the women quite quickly, because some of them obviously can be quite intimate quite quickly when you're walking into a delivery room. But I treat them as my professional friend. So I treat them how I would want someone to treat me, whether that's having a giggle with them, because when you're in a room with someone for 12 hours, that's quite a long time, or helping them through any tough times that they're going through, if it's not quite the birth that they might want, trying to coach them through, just being their go-to, their friendly midwife. As I'm sure with any other unit, sometimes when it gets busy, you don't have the time to spend with your women as you would. Sometimes you've had a delivery and then you have to go straight on to the next, which is no one's fault. It's just the way that obviously midwifery is sometimes. Or you're having to discharge one person quick before the next one comes. Or sometimes ladies have never even seen a baby before they have to change their nappy for the first time, and you just want 5 minutes to help her through changing her first nappy. And actually you have to prioritise your workload, and so it'd be nice to just have that extra time sometimes to spend that 5 minutes with something that some people think is quite small. It's actually quite a big thing for somebody else. But luckily, working here at Stoke Mandeville, we are lucky to have a fab team of breastfeeding support workers who are here on a daily basis to help us out. We also have a lovely team of maternity support workers who help with day-to-day care of our women, taking observations, helping them mobilise for the first time after section. Sometimes when you have to prioritise your load and you don't have quite time to get there, or just answering the call bells for 2 minutes, it just really helps you out, and we have a great team that do that. I like it here because everybody, to me personally, is a big family. It doesn't matter whether you are the consultant obstetrician, the porter, it doesn't matter if you are a fellow midwife or the band 7, everybody works together. I don't ever worry about coming to work. I just enjoy coming to work because everybody is your friend, and we're friends outside of work as well as in work as well. So when the days are harder, or sometimes when you do get the odd, rare, quiet day, everybody gets on and you can have a little giggle at work as well as outside of work, and it just helps everybody through. I've obviously worked in other countries as a midwife, and I have come back to here without a shadow of a doubt. And I just think, although other hospitals, they might be all big and fancy, but actually this is a smaller unit, but that makes it nicer because everybody works together, everybody is a team player, and I don't know why I want to work anywhere else. So living in Bucks is a perfect compromise between town and country living. There's plenty of places to walk with your dog. There's the local parks, there's the Greenway to walk or up Coombe Hill. There's plenty of shopping in town, in the precinct, or lots of bars and restaurants or cafes. Sometimes on our day off we all like to go for a coffee and a catch up and socialise a little bit.
I'm a community midwife at Stoke Mandeville Hospital. My job varies from working mainly in the community, covering antenatal clinics, postnatal clinics, bookings with women initially when they get pregnant. We're called into the unit on time at times as well to help on labour ward as well as postnatal ward, and we attend home births for women that have asked for them. I love looking after women and their families. I love making a difference. I love it when I can be part of their journey, and I feel privileged, genuinely privileged to be able to do that and to make a difference and hopefully be remembered for that midwife that touched them during that journey. The most challenging thing I think in every job is either when something goes wrong and you're not expecting that, because we're all humans and things happen and we can't, some things are beyond our control. That upsets me, but then we've got a good network to turn to so we can talk and reflect on that. And I don't like politics. That's the one thing I don't like, and I'm sure everyone else doesn't like that, but that's part of every job role. So I'll just say those two things. I like working in Bucks because we've got a multi variety of women that work together. We've got males as well with our doctors, females, and we generally work really well together. We've got some managers that are very, very approachable, as in any place. I'd be lying to you if I said everyone was, because we are all varied and we're all different. But because we've got those people, it makes a massive difference. I'd say come, because not only do you have, if you want a challenge, there's challenging areas, and if you want something where you just see nice things happening, we've got that. We've got a very varied, Bucks is a very varied place. So you've got, it's mainly affluent, but we've got cases that need an extra hand. So you'll get a varied of everything. So if you want to come to Bucks, the area is lovely, the people are nice, and they're approachable. What I like about Buckinghamshire, I mean, I could move to a different country, but I can't move out of Aylesbury, so that's a bit, you know, sad. But I love Aylesbury. I've lived here all my life. I've seen it grow. I've seen that there's lovely scenery still, even though we've had so much housing. I've seen it's quite quiet compared to other areas. It's very diverse, in my opinion. It's a nice place to live, and where there is areas that need help, I do a lot of volunteering as well outside work, so I find a lot of gratitude, you know, I find a lot of gratitude in that for myself, self-gratitude. So I like that and I enjoy it, and it's a safe place for my children to be brought up as well. The schools are good, the area is good, shopping's, I can't lie, shopping's rubbish.
So I work in the antenatal clinic. So that involves seeing all the antenatal patients, everything from working in the high risk, all the different antenatal clinics, and seeing women preoperatively before they're elective cesarean sections, and offering high risk antenatal care. So I also work in the preterm birth clinic with the lead fetal medicine consultant here, Ms Reddy. We've got a dedicated preterm birth clinic looking after women that have been screened antenatally at being high risk for preterm birth is really important. It's highlighted in the Saving Babies' Lives, and we run it every Friday morning. It's really great. The women get great continuity of care and see the same midwife and doctor, and we take part in there. All our data is collected for part of the preterm birth network, and there's plenty of learning opportunities from that to still take part in study days when they're running, you know, outside of the pandemic.
What do you love about your job?
I mean, I love being a midwife, but particularly love being a midwife here. It is a really nice team. I have worked in a different, bigger trust before, but here it just seems like everybody's really friendly, everybody's approachable, from, you know, your other midwifery colleagues, matrons, consultants. You never feel like you can't ask somebody if you're worried or you just want to check through with somebody. I think wherever you work, there's always going to be challenges in midwifery. So the same sort of things. Sometimes there are staffing issues, and you know, sometimes the workload can feel quite heavy. But I think I've always felt that when that's happened, I can just go and escalate it, and actually somebody will listen and do something about that. And I honestly don't think I've ever felt like it has been so overwhelming, and I've just been left to sort of deal with it myself, and that is really huge. You have so much opportunity. The women that you see, I used to work in Oxford at the high risk, you know, I felt like if I moved here I would miss out on that, but that's not the case. But also, if that's not your thing, there's the birthing centre, lots of good. They've just started the Blossom team, sort of a low risk continuity of care. I think there's plenty of opportunity here for whatever part of midwifery you enjoy, and I would say do it. Well, hilariously, I don't actually live in Buckinghamshire. That's how great Bucks NHS is, because I actually moved to Cornwall, and I still come back here to do shifts. It's that great.